Hello everyone, I'm Dr. Francisco, a specialist nephrologist and transplant immunologist working at Francisco Kidney Medical Center in Singapore. Welcome to the Diabetes Health and Prevention video series. Today is time for the part 4, What is Diabetes Mellitus? I hope you enjoy it. These talks are part of our efforts on health promotion, focusing on diabetes prevention and early detection, so you can become a healthier version of your previous self. As mentioned before, we also have two health enhancement and weight management programs, ARIS and JANUS. ARIS is a sort of a startup program to start your battle against sugar and start losing weight, mainly dedicated to people that just need a little bit of a trigger to start this process, that they are confident that they can take care of themselves with a little bit of coaching. Or for younger people that they want to lose weight and fitness is also part of their interests, or for people that want just a trial first before committing to the JANUS program, which is a more complete and comprehensive program that is indeed focusing on people that are health conscious, that they want to achieve better health with loss of weight and maybe also look fitter, but health is their priority because either they have risk factors for metabolic disorders of diabetes like overweight or other conditions, or they have these metabolic problems already, or even diabetes and they want to prevent complications. It's a more structured coaching by doctors, dietitian, or even a fitness or physiotherapist, and with the aim that eventually empower the patient to take care of himself or herself in a better way, to achieve that confidence that they can do these changes and they can continue these changes after exiting the program. For people that maybe have tried and failed, or maybe they have delayed these trials, just saying, I will do it later, but that later never comes. So we hope that we can help people with this JANUS program to eventually achieve our slogan. If you're interested, please call this number. Let's start our talk. So what is diabetes? Diabetes is a condition characterized by high blood sugar levels. It is due to the inability of your body to process excess of blood sugar after meals and drinks. All this as a consequence of impaired production or function of a hormone called insulin, which is produced by the pancreas. And if this condition is not treated properly or not treated at all, or the sugar levels are not well controlled, the blood vessels of all your body will get progressively damaged, impairing the circulation to many organs, including the heart, the kidneys, the brain, the eyes, nerves, feet, among others. There are two main types of diabetes mellitus. There is type 1, which is a condition characterized by destruction of the beta cells of the pancreas, the ones that produce insulin. Therefore, there is an incapacity to release insulin in response to rising sugar in the blood. Therefore, high blood sugar and all its complications ensue. Just this diagram illustrates that. There is destruction by the immune system that gets dysregulated and destroy the beta cells. So there is no production of insulin and the blood sugar rises in the blood. There is another type of diabetes, it's called type 2, which is characterized by dysfunction of those beta cells, not necessarily destruction of them. They produce the insulin in the pancreas, as mentioned before, but there can be a deficiency in that function, and also a deficiency in the utilization of sugar, a deficiency in responding to the insulin effect, what is called insulin resistance. Just to see this graphically, the patient with type 2 diabetes mellitus, their beta cells are not functioning very well, They produce a deficient amount of insulin. The cells of the body become resistant to the insulin effects, and the blood sugar rises in the blood. Importantly, type 2 diabetes mellitus is the most common. Could be 90 or 95% of the cases of diabetes mellitus. In some populations, even more than that. It associates with obesity because that creates increased insulin resistance, and associates also with the metabolic syndrome. But importantly, it is preventable. And that's why we're focusing with these ARIS and JANUS program, trying to tackle diabetes at the early stages before it appears, or tackle it at early stages to prevent all the complications. So I hope this short video was useful to at least know what is diabetes. Please stay tuned to learn more about our health enhancement and weight management programs. Please subscribe to our YouTube channel. Stay tuned for other videos. Please share these videos. Maybe you don't have diabetes, or you are not at risk, but maybe a friend or maybe a relative is at risk for diabetes and maybe want to learn more or should learn more about these conditions. The next video is very important. Is pre-diabetes, which is actually what we want to tackle mainly in our program. You will hear about this in the next video. Stay tuned. Thank you for your attention. Take care.